Dr. Robots will now show us how to set up the echo machine. Of course, it's very important to optimize the image because the analysis and the interpretation of the echo image is highly dependent on the quality of the acquisition. Therefore, he will show us how to optimize the images via different parameters and also how to prepare the patient.
The subject of this topic will be how to set up the echo machine. It's very important to set up your echo machine well, to get optimal image qualities and to make the right diagnosis for your patient. Before you start an echo, it's very important to make sure your patient is laying comfortable on the table on his left side, with his left arm up to open up intercostal spaces, and with his left arm next to his head, not under his pillow, not to have muscle tension, because when you have muscle tension, you will have less quality of your echo images. Also very important before every echo examination is that the room is darkened to have optimal image contrast, and that the room is silent, because the audio you have to use to optimize your Doppler signals. And then as well, very important is that every examination, echo examination, has to have a good ECG, because the ECG is used for timing, and you cannot do analysis of diastolic function or any other timing of asynchrony without a very good ECG. So this is before starting the examination. One last remark before starting. Ultrasound machines need maintenance. So if you have a machine which is more than 10 years old, the probe is worn down and your echo quality cannot be optimal. So at least once a year you need to maintain your echo machine. So when we start the first part of your echo image, you should look at the power of your echo machine. The power of your echo machine is the amount of energy that is given by the probe. This will give you, if you put the power higher, you will get an optimal echo image and you will get an optimal signal to noise ratio. If you lower the power, like in this example, you will see the image will get darker. So why not to use maximal power all the time? Well, we are not sure. There is some examples when echo contrast is used and maximal power that we can have tissue damage. And for instance, here the mechanical index and the thermal index give an indication on how much mechanical influence you have on your tissue and how much thermal, so heating you have on your image. So the tissue power or the power of your echo machine is important, should be as high as possible, actually as low as possible, with the best image quality. The next point we should go to is gain. Gain settings of a machine. In this case, we have a very low gain setting, and this will not allow you to look at the muscle very well. So optimal gain setting should allow you to have view of all parts of your echo image. Some people tend to overgain their image. And I must say, gain is something very personal, but often if you overgain your image, you will get a lot of noise actually in the blood pool, because when you gain, you increase as well your signal as well your noise. So your signal to noise ratio stays the same. That's contrary to increasing power. When you increase power, you will get a better signal, but you will not increase your noise. Depth gain compensation is something you have on every echo machine. This is because every patient has a different size and has a different attenuation of the echo signal in the depth. So you can correct per patient in the depth. And here I will give you an example. This is an example of a good depth gain compensation. Here the apex is too dark, while in this case the base is too dark. So you should have an optimal depth gain compensation in every patient, although at the start of your echo examination it's best to keep it central and to work with your active gain. Another important modus on your echo machine is your transmit frequency. Usually your transmit frequency is in second harmonic imaging, which means that the second harmonic reflections of your ultrasound signal are used as well to optimize your image quality. So second harmonic imaging will improve your signal to noise ratio, but it will decrease your axial resolution. So in order to look at some very fine structures, you might find it necessary to step away from the second harmonic imaging, as I give in this example. So changing the frequency of your probe or getting away from second harmonic imaging, getting to fundamental imaging allows you to look at very fine structures, in this case like the tip of the mitral valve, leaflet, or the chordae tendineae. The best frequency to use is the center frequency of the probe. If you have small patient children, you need a higher frequency, a higher probe frequency, because the higher frequency will give you a better resolution, but will give you less penetration. The lower you go with your probe frequency, the better the penetration will be, but the less the resolution will be. And probes do function the best at their center frequency. So, but there are occasions that you can step away from second harmonic imaging. However, in default mode, it's advised to use as much as you can this second harmonic imaging. The next step is the focus point. An ultrasound field is constructed like this, that your focus point is best at the deepest structure of interest. So usually at the bottom of your echo image. If you go higher, you can focus on different parts of the heart, but the payoff, the trade-off is that you will lose a lot of focus in the lower parts. So if you want to look, for instance, at an apical thrombus in a ventricle, you can put the focus very near to the near field or in the near field. However, for normal imaging, your focus position is best at the lower structures of interest. Modern ultrasound machines have the possibility to have dual focus. This dual focus will allow you to optimize your focus in more parts of the heart. However, this is at the cost of frame rate. So if you use post-processing double focus, you will lower your frame rate. And this can be a problem in certain situations, like when you want to use speckle tracking, you want to do the tracking of the myocardial tissue, then you need a certain amount of frame rate to get optimal signals, and then you should not use the dual focus because of too low frame rate. I come back to frame rate. The image, the echo image, is always a trade-off between the number of lines and the axial resolution, so the lateral resolution you have, and the number of frames per second. The more frames per second, the higher your temporal resolution, the lower your lateral resolution will be. So it's a trade-off. And again, for certain post-processing algorithms like speckle tracking, you need a high frame rate. However, in this case, you see the frame rate is 84. In my other example, you can see where it's 50. The normal echo setting, you should not have your frame rate too high in the 2D grayscale imaging because it will improve your lateral resolution, and that you need to get optimal imaging. I think now we should move to Doppler signals. To use Doppler signals well, this requires some skill and also some points you really have to look at. The most important one is good alignment. Everybody knows that Doppler echo signals are related to angulation. So if your angulation is not optimal, as the case in this aortic valve, then you will underestimate your velocities. In this case, when you tilt your probe and you align the probe well, you reposition the probe, you align it well, you will get just higher velocities. And in a normal aortic valve, it might not differ a lot, but especially if you look at high velocities, aortic stenosis, for instance, it will make a big difference. So very good alignment of your echo image, of your beam to the flow of the blood is very important. The next step is the velocity scale. If your velocity scale is too low, you will get something which is called aliasing. And aliasing does not allow you to make correct measurements. So On the other hand, if you put your velocity scale too high, you will not resolve the velocities very well. So if your scale, in this case, is way too high, you will not be able to measure the velocities correct. So the optimal velocity scale is the one where your Doppler signal is at the bottom of your image, and we can resolve all the velocities without having aliasing. The next step is the sample position. In this case, we look at the inflow of a mitral valve, and it's very important to put your sample in between the valve leaflets. This is an example where the sample is too high in your mitral valve, and this is an example where it's too low. When it's too low, or when it's quite low, you can use this in certain circumstances to look at the duration of your atrial part of your mitral inflow. And sometimes it's necessary, especially when there is aortic regurgitation, which involves the anterior mitral valve leaflet. Sometimes you have to put your sample volume quite low to be able to measure duration of the A in your mitral inflow signal. But the required position is in between the tip of the mitral valve leaflets. So your sample position is very important. Next point I want to mention is sample volume. If you put your sample volume very wide, as we have here, you resolve more velocities, but your signal is not crisp. It's much more difficult to make correct measurements. If you put your sample volume very low, as is the case here, the sample volume is only 1 millimeters, you will have much more crisp signals where you can do measurements, but you might not resolve all velocities that go through that sample volume. So the optimal sample volume often is in the range of 5 to 7 millimeters. Then there is something which is called wall filter. So certain velocity signals are weak, while others are more hard. The ones, if you look, this is a case of a pulmonary vein. If we want to make sure we see the full pulmonary vein and we can measure all the different peaks, so systolic, diastolic, atrial reversal, and duration of your atrial reversal. To do this well, you should put your wall filter at optimal settings. If you put it too high, you can't see the duration of the atrial reversal. If you put it too low, you have the noise from the wall or the muscular part of your pulmonary vein, and this will also not allow you to correctly measure the duration. So the use of your wall filter when measuring a pulmonary vein or when measuring a very weak aortic insufficiency, it's very important. One more factor to look at is your sweep speed. To do correct measurements and to measure your Doppler signals well, your sweep speed should be as wide as possible, 100 millimeters per second. At this moment, you can perfectly measure your E, your A, and your duration of the A. However, if you want to look at interbeat variations, if you want to make sure when there is pericardial effusion that there is no respiratory variation, that there is no signs of tamponade, you can use, first of all, the respiratory sign, the respiratory trace, to see when the patient is breathing in and breathing out. And you can adjust your sweep speed to, in this case, 25 millimeters per second to look at interbeat variations of your different signals. So sweep speed, keep it on 100 millimeters per second. If necessary, you want to look at interbeat variations, you can decrease it. Now we're looking at our color box. The scale of the color box is important as well. In this case, I put the scale very high, minus 90. So you will also lose information. However, if you put the scale very low, you will get the same problem as we had with the Doppler signals. You will get aliasing. And in this case, there is no manner to distinguish whether there is aortic regurgitation or the flow is laminar or is normal. So your velocity scale should be adjusted also in your color box in this case, the setting is optimal. Then we have something like color gain. So as you can increase or decrease the gain of your Doppler signals, you can also increase the gain of your color box. However, if you overgain, you will get information which will not allow you to distinguish laminar flow from turbulent flow. So the gain of your color signal should be adjusted as well. In this case, it's perfect. In this case, it's a bit undergained. Another important new feature on echo machines is the possibility to look with Doppler at muscle velocity. So we don't look at blood pool velocities, we look at muscle velocities. This is called myocardial Doppler imaging or myocardial velocity imaging. And I will show you how to optimize the echo image. So you center your image of interest or your region of interest, in this case the septum. You make sure your depth is fine, and then you go to tissue Doppler imaging. There it's important to also look at your scale. If you see green reflections here, your scale is not adjusted well and you have aliasing in your image. So make sure your echo image is aligned well. You have a small sector angle because this will dramatically increase the frame rate per second. This allows you to store the image like that and then in post-processing to look at velocities in the different regions of your wall. Look at velocities, look at strain rate or strain, look at deformation. I'll show you another example as well. If you look at pulsed wave velocities, if you want to make sure you want to measure your EE prime, you can do it as well from the small sector angle. And it's important here that you put your sample that you measure in the dense part of the signal, not at the outer parts. So use the dense part of your signal if you want to look for EE prime. In this case, EE prime is 9.9. I select the septal wall. You can also use the lateral wall, but then you just should adjust your reference values. A normal EE prime, or at least EE prime, which does not indicate elevated left atrial pressures in the septum, should be below 15. The last point I want to show you is speckle tracking. If you want to do speckle tracking, you do the same. You look at regional function with velocities, with strain rate, or with strain, but you do this angle independent with a grayscale tracking algorithm, which is available on most echo machines. It's important there to look very well at the frame rate, because these algorithms need to have a certain specific frame rate. In this case, the frame rate should be between 50 and maximum 90. If it's too high, the algorithm doesn't work. If it's too low, you also will get errors. So it's important to look at your focus position. In this case, I don't have dual focus, otherwise I would compromise my frame rate, and my focus position should be low. Now I can store this image and go to post-processing to do the speckle tracking. So the machine automatically tracks all the different segments of, in this case, the posterior wall and the anteroseptal wall. Once it also checks automatically the quality of the speckle tracking. If you agree with the quality, you can approve it. You have to approve also on the timings, and then you get the results of these different segments. You can look at the curves. You can look at the individual curves. In this case, so during systole, all the different segments of the patient deform, shorten well during systole. And also relaxation looks normal. If you do this for the 3 views, 18 segments, you can construct a bullseye which gives you the information on the regional function, longitudinal function of all of these different segments. So this is how you optimize your image for speckle tracking and how you do the post-processing. Doing a correct echo examination requires to know your machine, to make sure your machine is maintained well, is performing optimal. And this is the start of doing a good echo examination and doing correct patient care. So I advise everybody to go through the settings, test them out, and once you master them, you can start doing your echo examinations. Good luck with it.
So it's very important to keep in mind that for each patient, the image should be optimized, depending on the structure you want to see or the flow you want to see, and this will allow a better diagnosis.